Every breast cancer patient has their own journey. And treatment for breast cancer is continuously evolving. Patients have more options now when it comes to their path of care. Let's talk right now to Dr. Pat DeFuscio, Director of the Breast Program at Hartford Healthcare, to discuss treatment options. So did I say your name right, Doctor?
It's Dr. DeFuscio. Thank you very much. It's a pleasure to be here.
Thank you. So tell me, what is meant by early stage versus metastatic breast cancer?
So early stage breast cancer is a woman is first diagnosed with either a lump or potentially lymph nodes under the arm. And their treatment at that point is usually some combination of surgery, radiation, and either hormonal therapy or chemotherapy. And after they are first diagnosed with the breast cancer, then we go into a period of active surveillance.
What is appropriate surveillance for early stage breast cancer then?
So for these women, we tend to follow them now by history and physical exam, and we do imaging or x-rays as indicated. So we try to address any new symptoms, any bone pain, any tenderness. We look for any lumps or bumps on exam. We don't routinely do CAT scans or bone scans or PET scans to look for recurrences. I think one of the exciting things in the near future is that we may be able to detect by blood tests whether there's residual disease within patients, but we're not quite there yet.
Now, I'm sure there are goals for the care for metastatic breast cancer, and there are like benchmarks you want to reach along the way?
Yeah, so when a woman is diagnosed with early stage breast cancer, our goals are primarily to try to cure the disease and to prevent a recurrence. And that's why we tend to be very aggressive with our hormonal therapy and our chemotherapy. If a woman is found to have metastatic breast cancer, however, if the breast cancer has spread, we still can offer very successful treatment, although often our goal is more that of control. But even that being said, we can offer lifespans of years to women with combinations of treatment that we have to offer.
And quickly, what are some of the treatment options or the ones that you guys use the most?
So if a woman, it's basically divided by the type of cancer a woman has. If there's hormone responsive, if the tumor is sensitive to hormones, we can use pills and hormonal treatments and potentially exploit many different options there. If the tumor is got a protein called HER2 and it is driven by that protein, we have distinctive drugs that can affect that, and again, very successfally. And if it's triple negative or it lacks any hormonal or other protein markers, then we can treat that sometimes with immunotherapy. So our armamentarium is growing quite a bit.
Dr. DeFuscio, thank you, Director of the Breast Cancer Program at Hartford Healthcare. We appreciate your time this noon.
Thank you very much. Thank you for having me.
For more information, please visit hartfordhealthcare.org/breastcancer.